right, so hi everyone. I'm Anna, one of the fourth years, and I'll be talking about event medicine today. Why event medicine? So in your fourth year, you have a lot of free time. You get like 4 weeks vacation, 8 weeks elective time. I wanted to do something that was fun, something I enjoyed outside the hospital with the hospital. So I did an event medicine elective with Maimonides. Pretty easy to set up. It was very fun, and I'll share some of what I learned during this rotation. So what exactly is event medicine? It's a specialized area of emergency medicine focused on providing pre-hospital care at very large gatherings, such as concerts, sporting events, or festivals. It's also known as mass gathering medicine. The point is to treat and stabilize anyone that needs any medical attention during a large gathering. So at each event, there is a medical team responsible for providing care. It consists of a mix of EMTs, paramedics, nurses, and a lead physician, which will be you during this rotation. So for each team, for every 10,000 spectators in an event, you need one team of like 2 to 6 nurses, paramedics, EMTs, either mix of those. For every 50,000 spectators, you need 1 or 2 physicians. And for every 100 participants, like in a marathon or something, you need 1 to 2 per 100. At the very top, there's a person, the event medical coordinator or director, who oversees the logistics behind everything. So you're there just for the medical aspect, and they're there more for the like logistics and any questions you have to ask about something you don't know. So for the EMTs, as you guys know, they're BLS trained. They can do vital signs, do very basic airway management like an oral or nasal airway, give oxygen. They can only give certain medications, not any IV medications. So they can give epi for severe allergic reactions or anaphylaxis. They can give glucose for hypoglycemia, and they can give naloxone for opioid overdose. They can also help patients with their own medicines like inhalers or something, but they can't do anything beyond all of that. They can also perform EKGs for you to interpret, but they themselves cannot interpret it. For the paramedics, they're ACLS trained, so they can do everything that EMTs can do, but they can also intubate and do higher level of care. They can start IVs, give IV medications, give fluids, and they can also do EKGs, and some of them actually can interpret them. Usually like the STEMI alerts that come to the hospital, they're likely paramedics that bring them in. So during these events, the paramedics and the EMTs will bring a wheelchair and respond to the calls and bring these patients to you if they're stable enough. Some events will have nurses. They're kind of like a mix of the paramedics and EMTs. They do exactly what they do in the hospital. Like they can help with CPR, start IV medications, give medications, and all of that. So most of these complaints at these events are pretty straightforward. The EMTs and paramedics can kind of handle them themselves, and they won't even like ask you any questions. They'll sometimes distil them on their own. They'll just let you know that, hey, there's a patient here for this and that, and then you don't even need to like see the patient, maybe just eyeball them or something. So for us as a physician, we're there to determine the severity of the injuries or the illness and to provide consult on more complex cases. We need to stabilize the patients who need to be transferred to a hospital and coordinate their transport, determine if they need like a ALS, BLS, or they can go by like Uber, private car or something. And sometimes they'll ask you to respond to the call at the place where the patient is, and that's never a good sign. They'll also let the last one out at these events because you need to make sure all the workers are out, spectators are out, and if anything happens, you're still there to treat anyone that needs it. And for you as a physician, it's basically like a CYA for the event to say that there was a doctor available and on the premises. So they really need your license, basically. So what supplies are available in pre-hospital setting? So it's similar to what EMS has in their ambulance. There's something called the Life Pack, which is up there. It can take vital signs, do a 3-lead or 12-lead EKG, and it can also cardiovert or defibrillate. There's also some very basic medications in these places, in these medical tents, offices. There's Tylenol, ibuprofen, Zofran, antihistamines like Benadryl, cetirizine, EpiPen, Narcan, topical lidocaine for burns, and there's also code medications too. You have all the simple stuff like gauze, bandages, Band-Aids. There's also intubation supplies if anyone needs to be intubated on the premises. And there's also suture kits and Steri-Strips in case someone does have a laceration and you have to close it then and there. So the medical legal aspect of this is that people in the US love to sue, right? But documentation is key, just like in the hospital. Keep your notes simple, document what you offer them. Like if you offer them like an ambulance to go to the hospital, but they decline, just make sure you document very well. And in terms of coverage, there is usually coverage from the employer itself, like the vet medicine company or something, or you can have your personal liability coverage along with it. Us as a resident doing this rotation, downstate would cover us. So what about the pay? The pay is pretty okay for what you're doing. It's $100 to $120 an hour on average. That's less than what you'd make as an attending, but it's a pretty like straightforward job if nothing crazy happens. Most of the time, you're just kind of there to be there and you're just spectating and watching things or doing very simple things. So it's not a bad pay. Sometimes though, if it's affiliated with a hospital, like for MIMO, some of their attendings will work a shift at these events and they get like a little money on top of that, their normal salary pay. So not a bad gig overall, to be honest. So what can you expect? You guys want to shout some stuff out at these events? I'd say like a festival. Intux, drugs, yeah. Sprain, trauma, yeah. Yes. So the what? Crowd, yes, that too. 100%. Syncope, yeah. So basically anything and everything, right? It's a whole world out there. People do crazy things. It's basically why people come to the hospital in the first place. So expect anything and everything. So some things I'm going to show you are just some like real life articles. These are all articles from deaths related to drugs, alcohol, whatever they took that day at festival settings, concerts, whatnot. Lots and lots of deaths. So people like to mix drugs and alcohol without being really aware of the dangers. They just want to have fun for one day, 1 hour, whatever. You can see a lot of like deaths and complications that occur at these large music festivals. Alcohol, drugs, and the key point is that you don't need to diagnose and figure out what they took exactly, but you just need to stabilize them and know when to transfer them to the hospital if needed. It's a fun little chart of toxidromes to expect. You have your anticholinergics, cholinergics, opioids, and methylmimetics, and sedative and hypnotics. And it's more like an easy chart for like the EMS paramedics to kind of figure out what's going on. And like you guys said, trauma, drugs and alcohol will lead to trauma. So at concerts and festivals, there are large mosh pits where people just go wild, punch each other, step on each other, fall down. And at stadiums, there are a lot of stairs. It's a new environment, lots of stairs. There's a big age range, elderly people, they trip, they fall, traumas happen. So with trauma, there's this 2017 Las Vegas shooting that occurred at a music festival. It was one of the deadliest mass shootings in the US, multiple traumas. There are 61 deaths and over 800 people injured at this festival. So you have to be ready for anything, even large MCIs. Speaking of MCIs, if something like this were to happen in New York City, we use something called the FDNY modified START, which stands for simple triage and rapid treatment. It's based on simple things like ambulation status, respiration, perfusion, and mental status. And the tagging, it's black tagging for dead. Red would be critical, who they need more immediate transfer to the hospital. Orange, which is specific to New York City only, it's for urgent transport to the hospital. And then yellow, which is serious, and green, which is not serious. They can both be delayed transport to the hospital or just home if they're green. So very important to note that viable infants less than 1 are all red tagged no matter what. Any non-viable are black tagged. So with marathons and other like more physical events with physical exertion, you might get some heat-related illnesses. You get hyper or hypothermia if it's a triathlon or something, dehydration, severe abnormal electrolyte abnormalities, MSK problems like cramping, muscle strains, skin things like blisters, rashes, and cuts. So back in 2022, the Brooklyn Half Marathon took place during one of the worst heat waves in the Northeast. And 1 person died at this marathon and a dozen were hospitalized just due to heat-related illnesses. Another thing to look out for is allergic reaction. There's all these like new food cards, food things that people are trying and they're not aware of what's actually in it. So it's important to know the signs of anaphylaxis, know the treatment, and know when to intubate if needed. There's this famous case recently at Disney World where it was a doctor that had a severe peanut allergy and the people at Disney World didn't tell her about it, or she asked and they didn't know that there were peanuts in there. So anything can happen, even possibly delivering a baby. So this is 2023, I think, at EDC, there's a woman who was 32 weeks pregnant and she went into labor during a set. The baby was born healthy, thank God. They didn't deliver at the festival. They brought her to the hospital. And they named the child after the DJ and the festival. Isabella, extra Z for Z, and Daisy, Isabella Daisy for Electric Daisy Carnival. So cute little story. So during my rotation, I didn't get to go to the Gorge Amphitheater, but the MIMO residents got to go there. There was a neonatal resuscitation happening at the Gorge Amphitheater, which is in Washington. So after I heard about that, I reviewed NRP right away to see what I needed to do if someone delivered at any event. So anything can really happen, guys. So what's important for us as ear doctors is disposition, right? They can either go back to the event, go home, they can decline care, they're stable, go home, but why not just bring them back to the event? But if they're like breaking rules or something, they would have to leave the premises. And then the most important decision is to see if they need to go to the hospital or not. So once you see a patient, you should automatically think in your head, stay or transfer. For every venue, there's pretty limited resources in terms of ambulances. There's usually only one ALS or one BLS. So there's a lot of things happening at one time that need transfer. You have to need good resource management to figure out which to send with which patient. So with my rotation, it was at MIMO, done under CrowdRx, which is one of the large companies here in New York City. They sent me to MSG, where I saw a few concerts, treated some patients. They sent me to Yankee Stadium. Not a Yankees fan, I don't watch baseball, but it was cool to be there. Very, very fun. They sent me to the US Open, which is what all the residents usually want to do with this rotation. So I was lucky enough to get that, actually. And not me, but the MIMO residents get to go to the Gorge Amphitheater, where there are a lot of music festivals there that's out in Washington. I think they fly them out. And the most fun thing, they used to send their residents to Coachella, but not anymore. Something about the contract ending, or like the last time they went was that mud incident 2 years ago, and I think it was like danger to the residents, so no more Coachella. So next, I'm gonna go through some cases that I saw during my rotation and to see if what you guys would do for dispo-wise for them. So we have a 58-year-old male, has hypertension, diabetes, is an active smoker, came to the medical office, just kind of feeling some chest pressure, felt dizzy, felt really unwell. He did drink 3 beers before coming, and he's been having a few days of diarrhea. His vital signs, BP is a little soft, hundreds over 70s, heart rate's 99, rest of vital signs are okay. His exam, he's very diaphoretic. Every time he moves, tries to go to the bathroom, he's sweating up a storm. But heart sounds fine, lungs are clear, no leg swelling. EKG has like a mild T-wave version and V6. What would you guys do with him? ChatGPT says, give him some fluids and recheck. So we gave him fluids and his BP is maybe like 110 over 80 now. Yeah, transfer, right? Like even though his EKG has like no clear STEMI, like he's pretty diaphoretic, he has some risk factors, so we transferred him with ALS ambulance. He really wanted to go back to see Slipknot, but we said no. So the next case, you receive a call for the physician to present. So remember I said that's never a good sign. We have a 21-year-old female, no medical problems. She was found by her friends unresponsive near the seat. The friend saw her an hour ago, drinking and talking to two new guys, left her alone. Not very good friends. She returned to her seat. The friends went to the bathroom and left her there alone. They came back and found her just on the ground. Again, she needs new friends. Yeah. Her vital sign, she's a little hypertensive for like a young girl, 140s over 80. She's tachy to hundreds, but she's protecting her airway. She's respiratory rate is 16, saturating 100% on oxygen. On room air. Her physical exam, her primary is intact. She has dilated pupils bilaterally. And I'm sternal rubbing her, and she's only just like making some groaning sounds and like moving her arms ever so slightly. What should we do with her? Transfer, yeah. So, yeah, I think the cops were involved because it was at Yankee Stadium. The cops were there already. So they went to the hospital with her. So she was probably drugged to someone quick on, quick off, right? Because she was like, she went back to her friends and all of a sudden she's on the ground. So the same rules apply outside of as they do in the ED. If you came in walking and now you can't walk, you can't go home. So transfer. Next one, we have a 21-year-old male, no medical problems, carried to the medical tent by his friends after they couldn't wake him up in the seat. They did drink alcohol today. He's now a little more awake and he won't give you his ID. His vital signs are all fine. His exam, he smells like alcohol. There's no signs of head trauma and he is following commands, but he's still pretty unsteady. What should we do with this guy? Yeah, so this guy's got to go home. So he was actually 19 he told us he was 21, but his ID says he was 19. So we let him sit in a wheelchair, sleep it off, and his mom came for him. Big trouble. All right, just a few more cases. We have a 45-year-old female, just has hypertension, came to the office after an episode of syncope. Her husband caught her before she fell to the floor, but she did bump her head on something plastic, so some head trauma. She was visiting NYC and was in the sun all day and came to the game right after. Her vital signs are all normal. Her exam, it's pretty unremarkable. She has just a small abrasion to the forehead, no hematoma, no baseline tenderness, no deficits. And her EKG is pretty unremarkable. What do you guys want to do with her? So I didn't hear any transfers, right? So she went back to the event. So people pass out all the time, right? But it's very self-selecting who comes to the hospital for it. Like in the ED, we do this whole like syncope workup, maybe even obs for syncope, but not everyone needs all of this. So she was fine, probably just a vasovagal syncope. She went to go watch the game and she's gonna go see her primary care doctor sometime this week. And then this should be the last one. So this one, I also received a call to come to the patient. Again, not a good sign. We have a 78-year-old male, history of hypertension, diabetes, CAD on aspirin, just writhing and moaning on the ground after falling down 10 steps. His BP was a little elevated, 180s over 110s, heart rate was 98, respiratory rate was 20, and he was saturating 100% of room air. Primary is intact, he's protecting his airway, but there's a large hematoma to the forehead. Pupils are equal, but they're very sluggish. He's just mumbling to himself, pushing your hand away when you're trying to examine him, but he is moving all his extremities. What should we do with him? Transfer. So the closest trauma is 8 minutes away. His GCS is, let's say it's a 10. Who would intubate him here? He's fine, yeah. So for him, he was rushed to the closest trauma center, which is 8 minutes away. I didn't intubate him because he still had time to get to the trauma center. I wanted the team to see his neuro exam and everything, but they did intubate him right away when he got to the hospital. Because someone like him, I think a lot of us, if he were in the ED and CCT or something, we probably would have intubated this guy just because his mental status was like declining. But I think for something like this, it's better to have him in a more controlled setting and have like a backup team, intubate him there. Yeah, so it's a transfer too. So the more important thing is to transfer him to the hospital. He probably had a bleed just based on his exam. He's like an old guy, fell 10 steps, had trauma. Pupils are like very sluggish. The EMTs didn't stay there for everything, but they said they did intubate him right away.
To be honest, I think that they shouldn't even have called you, they should have transferred him right away.
Yeah, I know.
Yeah.
I used to talk to the Mets games,
Mhm.
there are plenty of people that I never even saw. They would call me and I would say, just take them, and the EMS would just take them straight out and go straight to the hospital.
Yeah, it took a while to get to him because the whole place was clearing out and it was at Yankee Stadium, so a really big stadium. So it probably took me like 3 minutes to like run there. So for transferring at MSG, it's in Manhattan. There's not too many hospitals nearby, but for trauma, you go to Bellevue, stroke, you go to those hospitals, and STEMIs, those. Yankee Stadium has a lot more options to bring patients to. You can see with trauma, there's more hospitals to bring them to. Stroke, there's like 6 hospitals you can bring them to, and STEMIs, 4 hospitals you can bring them to. With this new like EMS thing, we used to ask them like, hey, which hospital would you prefer to go to? And the EMTs would bring them there, but with this new rule, I don't know what they're gonna do. So some pictures from my rotation. Slipknot 25th anniversary. Who here thinks I'm a Slipknot fan? I tried it out for 5 minutes and I had a really bad headache. So where we stand, the stage is like right here, and where the doctors would stand is like where you guys are sitting over there. So we're pretty close to the stage. Not my cup of tea. I also saw Tate McRae, who for the older people, they're kind of like Gen Z's Britney Spears. Yeah, Britney Spears of the Gen Z generation. There were a lot of dads at this concert. Now I am a fan. She was really good. And then this one, I saw Big Booty Land. 2 Friends. This was really good. This was a really good concert. They were the most well-behaved group. It's an EDM group. They're well-behaved spectators. I didn't get any calls and I just enjoyed the whole concert. This is me at the US Open, also fun time. So usually all the MIMO residents will like set up their rotation pretty early on. They get the prime spots. I was still lucky enough to be there. I was there the pre-US Open week where the players are there to practice. Each player has their own personal physician, but we are responsible for more like the Arthur Ashe Stadium workers. I don't know who I saw. They're just people playing tennis and practicing. And then here is a Yankee Stadium. This was also a really fun experience. I asked everyone if they wanted to come with me. No one came. We're allowed to have like 1 person to bring.
Yeah, because it's the
Yankee. So here I had the most calls because it's like a pretty large stadium. There's a big range of age groups that go to these baseball games, from like very young kids to very old people too. Also, a lot of people visiting from out of town, so they're out in the city all day and they come to the stadium and they're just really dehydrated and everything. And there's like various intoxications I saw. You'd be pretty surprised at what people bring to a baseball game. It's not just alcohol.
No, it's not Yankee Park.
Yeah. I had a Yankee bobblehead day. It was close, or I don't know. I don't know what that means.
I have called.
Okay. Yeah, that's why I'm wearing no scrubs, just because it's just better for doctors to be wearing not scrubs, I guess. I don't know. But you get a name tag that says physician, and it's a nice experience. Like they really respect you. The EMTs, paramedics really look up to you and look for you for like medical information and help. I felt like really like honored to be there.
Their car gets you pretty much any place in the stadium. You can go down.
Yeah. I just flashed my badge and I can just go anywhere I wanted.
Field.
No, they let me go to the field. Like I got pretty close and they even asked if I wanted to meet the baseball players, but again, I don't know anyone, so so I said no. But so as you can tell, I had a really great time during this rotation and it's available for you guys to do. It's available for residents in their final year. 3rd years can probably do it towards the end. but definitely need to be at a time when you're comfortable making decisions because there's a lot of autonomy during this rotation and people are looking to you to make those decisions.
They require medical license.
I did it. I didn't have a license. So no. So no. I guess my license was just downstate as in general because we were covered by them.
And on the start of your topic, I reached out to Friedman.
Yeah.
And he said.
No. But it's more for like you when you're comfortable making decisions because you will be there alone. So it's available April through September. So plan early. I did it in August, I think, like beginning of August. Reach out to Matt Friedman, reach out to me. You can Google Maimonides Event Medicine Elective. I thought about trying to do one here at County, but it's just not feasible. We used to have a connection with one of the other companies, but something happened with a resident from another program, so they don't take residents anymore. So we got to go to MIMO to do all this. And then all my thank yous. I'm not a sentimental person. We'll make it fast. Thank you to my family. Thank you to my partner. Thank you to my residency family, my class, and my program directors.